So let's talk about what it actually looks like in my practice, because to me that's the most impactful thing anytime I hear a story is what does real-world translation looks like. So this is my experience with the XL2 platform. These plots review my 43 patients, the first 43 patients that I had in the intended use population. 2 of them had moderate levels of autoantibodies, therefore they did not get reflex to XL2. 2 of the patients actually had a pre-test risk less than 5%. I ordered the test specifically to look at that CDT autoantibody part. When it came back negative, they were not reflex to XL2. That left me 39 patients. If you look at the post-Nodify XL2 risk of malignancy, you will see a large number of green dots below that 5% line. There are actually 20 patients that were reduced risk. That meant 51% of the time I had a clear path forward in these indeterminate patients where I could confidently recommend serial surveillance. And I can confidently tell you that this led me to ordering less PET scans and less invasive procedures on these patients and move them to CT surveillance. The other important thing to know is this is not just novel to my talk today. Your Biodesix representative can actually give this data back to you and provide clinical insight into your trends at any time. Outcome reviews such as this really allow you to highlight to referring physicians that you are using a comprehensive approach to nodule management. And again, I think this will dramatically improve the quality of your program. So who did I utilize this test in? I utilized this test broadly in my practice as shown here. The top third actually reviews those 43 patients and shows the pretest probability of malignancy. If you look to the far right, 8 of those patients, or 19%, were in a 40% or greater risk of malignancy. This is really my uncomfortable area. Do I truly watch and wait, regardless of the PET scan, or do I act now? The middle portion also highlights the nodule size, and like we've talked about before, the 8 to 10 millimeter range really is another uncomfortable, uncertain area for me, and I tend to use this test quite heavily in that patient population. Remember, if we can find lung cancer smaller than a centimeter, the lives saved that we can incur is really dramatic, 91% survival at 5 years. So to me, this is the greatest opportunity, like we highlighted in the case report with that early stage find. The lower portion shows the variability in the patient's age, and to the right you see some additional clinical factors such as smoking status, speculation, again showing the broad range of applicability of this in your clinical practice. Use this, and I can confidently say not just myself, but our multidisciplinary approach practice now confidently moves forward with these results, whether it's the CDT result that's positive or an XLT test that tells us to wait. So I would say absolutely yes, this has been a game changer for us.